A very common procedure that we perform in our practice is PE tube placement for chronic or recurring ear infections. Really common in children. Really common in children. The idea with the tube is that it's going to bypass a blocked eustachian tube, the connection between the back of the nose and the space behind the eardrum. In children, particularly, that passageway does not work very well for a number of reasons. Once that blocks, fluid can build up in the space behind the eardrum. It's a warm, dark place. Bacteria have a chance to overgrow and cause trouble. The idea with putting a tube in the ear is that we can make a small incision in the eardrum, suction the fluid out that's behind the ear, and then put a small Teflon tube like a grommet in a tarp in the eardrum that holds the incision open so the air pressure can equalize through the drum rather than through the blocked eustachian tube, and it works great to eliminate infections. The benefit of the tube placement outweighs the risk when a child has had about 6 acute infections a year, fewer than 6 infections, but infections requiring more than 1 course of antibiotics to clear the infection, complications of an ear infection, or fluid that's not infected that just persists. Any of those situations are no good for a child. The job of the parent is to be sure this child can realize his or her greatest capacity. The job of the pediatrician is also to be sure that every milestone for development is covered without any difficulties, including acquiring speech and being able to interact with the world to develop normal thinking. If a child can't hear, that's trouble. That's where we come in. The benefit of putting the tube in is to eliminate the infections, improve the probability that the child's going to be able to hear normally and develop normally, minimize the disruption that happens in family with a sick child, and just get the child through to successful adulthood. 6 infections a year, fewer than 6 requiring more than 1 course of antibiotics, a complication of the ear infection, or prolonged fluid that won't clear with medicine or observation.